Okay, final section of this chapter is vascular tumors. This is a relatively short section. We should be able to get through it quickly. The first entity is a hemangioma. Hemangio, blood vessel, oma, benign mass. So this was a benign tumor comprised of blood vessels. It's commonly present at birth, but the most important point on this slide is that it often regresses during childhood. So that if you have a patient with a hemangioma, in particular a kid, and you were worried about removing it, it'll probably just regress by itself. And again, that's high yield, especially if it's on the face, for example. You don't want to remove it surgically and create a scar. This will usually just regress on its own. It most often involves the skin, and I've kind of already briefly hinted at that. But it's also important to note that you can get hemangiomas of the liver. That's another common location for a hemangioma. This is what a hemangioma looks like. Basically, this is a tumor comprised of blood vessels. Now, important to note that when you have this sort of collection of what appears to be blood within tissue on the skin, one of the things that can come to mind is a bleed into the skin, for example, a purpura. And the way by which you would make the distinction is by pressing on it. If you pressed on this, it would blanch because you'd be able to get the blood out because all of the blood is in the blood vessels. However, if it was a bleed into the skin and you pressed on it, it would not change color because the blood is in the skin and not within the blood vessels itself. So that's an important distinction, and this is a classic picture of a hemangioma. Now, the next tumor is Angiosarcoma. Angio refers to blood vessel, and sarcoma would imply that it's a malignant mesenchymal tumor. So this is a malignant proliferation of endothelial cells. Remember that the endothelial cells are the cells that line the blood vessel. Highly aggressive, can occur in multiple sites, such as the skin, the breast, and the liver. And very important to know that liver angiosarcoma is associated with exposure to PVC. That's an association that was made decades ago. But again, liver angioma is associated with exposure to PVC, and we talked about this in the neoplasia lecture, so I'll refer you there. You can also get liver angiosarcoma with exposure to arsenic and thorotrest, so those are two other risk factors for liver angiosarcoma. And the last tumor that we want to discuss, and probably the highest yield tumor in this section, is Kaposi Sarcoma. Now, this is a low-grade malignant proliferation of endothelial cells, but what's super important is that it's associated with HHV8. That's the virus that drives this tumor. And if you go back to our neoplasia lecture, you'll recall that when I talked about viruses that cause tumors, one of them was HHV8 causing Kaposi Sarcoma. When you have Kaposi Sarcoma, it presents as purple patches or plaques or nodules on the skin. And the reason it looks purple is because you've got this proliferation of endothelial cells. However, these are endothelial cells. They are not complete blood vessels. And so if you were to press on this tumor, it would not blanch because the blood is not in an actual vascular channel. The blood is simply just interspersed in between these endothelial cells. So that's an important thing to note. In Kaposi Sarcoma, it usually involves the skin, but it can also involve visceral organs. Here's what Kaposi Sarcoma can look like. And again, you've got these purplish nodules, and again, were you to press on them, they would not blanch, and that's because it's really just a tumor of endothelial cells, not the complete blood vessel wall. And so the blood is present interspersed with the endothelial cells, but again, is not present within an actual channel, so these would not blanch. Now, there's three patients that get Kaposi Sarcoma. Number one, Eastern European males. So older Eastern European males, that's one group of patients that would get it. And when these patients get it, it usually is localized to the skin, and the treatment is surgical removal. So that's one patient with Kaposi Sarcoma. The second patient in which it's classically seen is AIDS. So patients with AIDS can get an HHV8 infection. Of course, this tumor is driven by HHV8 in all of these patients. But patients with AIDS can get an HHV8 infection of the endothelial cells, which would then result in a Kaposi Sarcoma. With AIDS, it can spread early and it can go to other tissues. The way by which you're going to treat these patients is to give them antiretroviral agents. That would then allow the immune system to recover, and the immune system would then kill the HHV8 infected cells, getting rid of the tumor. So that's the way by which you would treat an AIDS patient. And the third group of people that can get this are transplant patients. And when transplant patients get it, it involves the skin, but it can also spread early. And the treatment would be to give decreased immunosuppression. If you decrease the immunosuppression, you'll then allow the immune system to come back, and the immune system would then kill the HHV8 infected endothelial cells. So these are the three classic patients. And if I had to summarize Kaposi Sarcoma in just a couple words, HHV8 infection of endothelial cells, so a tumor of endothelial cells, creating those purple plaques, and then classically seen in these three types of patients. And that closes off our vascular section and in addition closes off the chapter.